I'm just waiting him to accept now.
Yeah, we're okay. We're good.
Hey, how are you, Dr.?
Hey, I'm good.
What a pleasure.
It's a pleasure for me too.
We have already 44 people hearing and seeing us. So first of all, thank you so much to spend your precious time with us. It's a great pleasure. You know, you are a legend in Brazil. I prepared that for you.
No legend.
Okay.
It's a pleasure for me too, Marcelo.
Yeah, you see that?
God bless America. Boy, we need that very badly.
Good.
Our country is in trouble.
Well, the world is in trouble.
The world is in trouble. Yeah, you're right.
Yeah. If you see in my left side here, there is the crystal statue.
Yep.
It's white point.
Yep.
Yeah. So it's helping us.
No, that's what we need. A lot of prayers.
Yeah. So I heard that New York, just like Rio, São Paulo, you got a very strong punch from the COVID infection.
Absolutely
so
right.
Tell me a little bit how you manage your time during that period.
Well, the thing is, the terrible part of the virus was that the hospitals were overwhelmed by very sick patients on ventilators and with all sorts of other illnesses. For us who were required to stay at home, as were most older people, it was just life as usual. I mean, I worked the same way as I always worked, on our meeting and so forth. It's just that we couldn't go out to movies or plays or ballet, and that was bad. But as long as we were healthy, everything was okay, and we were on quarantine and lockdown. And now the good news is the hospitals are becoming much better. The number of patients on ventilators and the number of sick patients in the ICU is going way down.
You know what? That's exactly what is happening in Rio right now. The private hospitals has less and less patients in the intensive care units, and even the public hospital now start going down the infection rates. I would say even faster than we imagined.
That's wonderful. That's fantastic.
Fantastic. Yeah.
But the bad part of this disease is if you get a bad case of it, it's so awful. I mean, it affects every part of your body. We had a webinar yesterday for our meeting on the vascular complications of COVID-19, and they're just awful, particularly in the central nervous system.
I was in your meeting yesterday. I saw the presentations, and I keep my work during the COVID period, and we did 3-4 surgeries for COVID patients a week. And what we see most of the times, although we saw some embolic, pulmonary embolic, etc., but we see most of the times the kind of disease that you see when the patient get a lot of noradrenaline. So it's a very distal ischemia.
Yeah. And it's hard to treat. I mean, the usual things don't work.
Yeah.
Because what it appears to be, the cause of the trouble is endothelial damage.
It is.
Blood vessels everywhere. And also thrombophilia.
Yeah. Especially in the lungs, in distal circulation, the fingers, the toes. So it's really a bad disease. But I think it's going down in New York and also in Rio and Sao Paulo. So things, we can see light in the end of the tunnel.
Well, I hope so. And we're praying that occurs.
Yeah. Are you doing some exercise outside, or you stay at home all the time?
No, you can walk. I mean, there's no reason to not walk. So my exercise is just walking around and wearing a mask and so forth. But, you know, the things you like to do, like going to athletic events or to plays or to movies, you just can't do that. And you can't go out for dinner with your family, etc. Those things are what we miss.
So, as you mentioned that, one of the things that many colleagues in Brazil and South America that are here with us, they're asking is about this meeting. Well, it's 47 years old now.
Yeah, it's the 47th year. Yeah, you're right. And
it's amazing.
Everybody
everyone is very anxious about that. So I know what's going to happen, but could you tell people so you postpone the meeting?
Well, yeah, we're very anxious about it too. And for the last 6 weeks, we've been dealing with the possibility of having a virtual meeting in November. And for us, that's just not possible. We have too many speakers. They come from all over the globe. It would be extremely expensive, and nobody would watch it for 6 or 12 hours each day, which is what we would be required
to totally agree with you.
So we have decided from the very beginning that the only way we could have our meeting in 2020 was to have a live meeting. And there's no substitute for people getting together, for industry representatives coming together with faculty, with customers, doctors all over the world. There's no substitute for that. There's no way to package that virtually. So our decision early on was to have a live meeting in November. And then it became apparent that the hospitals and medical schools in the United States were not allowing their staff doctors to travel
participating
the rest of the year, not because they're worried about the virus, but because they want to make up the lost money that they've been denied because
I follow that.
So we then decided to try to postpone our meeting till the first quarter of 2021. It'll be the 2020 meeting. We have the program. Marcelo, you are on it, and many other South Americans, Latin Americans. And we want people to come. And hopefully by February, we'll be able to do that. Now, that may not occur, but that's what we're shooting for. That's what we're hopeful for. And if people can't come from, say, China or Turkey or any of these faraway countries,
are you planning? So
they can send their
are you planning?
Yeah,
excuse me. Are you planning to test people? I mean, or just the thermometer or anything?
Well, we don't know what the rules will be in February, but whatever they are, we're going to follow them. If they require testing, we'll do it. We have thought about social distancing, keeping people apart so they don't catch it, wearing masks. We even thought about face shields. We'll do whatever we need to keep everybody safe. And
we have a question here.
Yes,
are
sure.
You planning to reduce the attendance of the staff?
We don't want to reduce the attendance, but if we have to because people can't come, we're still going to have a live meeting. And those faculty members who cannot come, we will have a system for doing their presentation on PowerPoint with synced audio and video, and they'll just go right up on the screen as if they were there. So we think if we can get even a smaller number than the usual 45 to 5,000 people, we can still have a meeting that works and that will be successful. Of course, we would like there to be a vaccine, airplanes to fly again normally, and everybody to come as they normally would. But we have to see. Nobody can predict the future.
Yeah, nobody. Yeah, it is true, because if the vaccine arrives, so you can give a shot to everyone, and everyone can make. That's one hope. And the second, if you do the meeting in February, and are you planning also to do the meeting in November?
Yes, we plan to have
both.
The 2020 meeting in February of 2021, and then the 2021 meeting in November. And we're going to ask people like you and others to send their latest hot topics, we call them, to us in November so we can plan for the meeting the next November. Because it takes about 6 months to put the meeting together.
Yes, so you have time, and you'll be interesting. Yeah,
it'll be okay. I mean, it won't be perfect, but nothing has been perfect during this terrible pandemic.
It is. Now, I think it's important to keep both meetings, to keep the tradition. So we never missed your meeting. I hope we could be able to be there in both meetings next year, and then a lot of Brazilian guys, doctors also agree with me. It's a very important meeting.
Well, we're glad to hear that, and we want it to go on forever, even after me, and we have arrangements that will permit that to take place. But obviously, the next 2 years are going to be a little tricky. It
is. It's, as you said, we cannot predict. It also depends a lot from the vaccine. If you got a shot for that, so it'll be much easier. Although I'm not sure if you are following, but our friends in Italy and in France, now they are going out even without masks.
Oh, I know that, and it seems, at least from Italy and from Pittsburgh, that the virus has become less potent, less serious. And if that's the case, that will even obviate or prevent the need for a vaccine. Obviously, again, no one knows. And we just have to do whatever's necessary. The one thing I didn't mention, worst case scenario, say New York City is locked down or closed, then we'll just delay the 2020 meeting till 2021. November.
That'll be.
We hope that doesn't happen.
Yeah, that will be the worst scenario. But it doesn't make sense at the moment that you think we're going to have a mass infection again.
I hope not. I mean, we don't know, but clearly there is evidence that the virus is getting less malignant. And if that's the case, then that'll be as good as a vaccine. Yeah,
we did the same, but we canceled our meeting this year, and we call aorta meeting, aortic subject.
Right, I know about it.
And that will be in May. I hope you could be here in May, so to give a speech for us. That would be nice.
That would be May 2021.
May 21.
Yeah, next year. Yes.
Yeah, next year.
God willing, you bet.
Yeah, great. We have a very interesting question from the audience here. Do you think? Are you planning to introduce a panel only of COVID vascular complications in the meeting?
No, we haven't done that because, again, everything is changing so fast. We have 2, maybe 3 COVID presentations, but we're not making that the theme of our meeting because hopefully by the time of our meeting, the virus will be in the rearview mirror and we can be forgotten and go back to a very near normal life. But we are going to have webinars like the one you mentioned where we definitely deal with issues related to the vascular complications of COVID-19. And if there are open spots on our meeting, we may well put in newer information about the virus if it's continuing to be a problem. We'd like to forget about the virus.
Yep. Yeah, I think we all would agree in do not talk a lot about it. But we are a little bit confused that you, in New York, you are following the CDC orientations or the World Health Organization orientations?
I don't follow either of them because they're both often wrong. And that's why when we try to predict the future, nobody can do that. The virus will predict the future, and our response to it will be determined by our scientific genius and your scientific genius. The one really bad effect of the COVID-19 virus in the United States, I'm sure it's true with Brazil too, is people aren't going to hospitals. They're not getting treated for the diseases that they need to be treated for, whether they be vascular, cancer, heart disease, etc. And we think that certainly by November, maybe sooner, we think hospitals have to open up to provide the non-COVID-19 viral care that is necessary for people that have vascular disease, carotid disease, heart disease, cancer, whatever. One of the real terrible things about it in the United States is people aren't going to hospitals because they're afraid. And they shouldn't be. They have to get appropriate care.
Yeah, it's true. Our patients from carotid disease, lymph disease, aneurysms, they disappear.
They're there. They're there. They just have to come. And I've told industry that our industry partners who make all the devices, their business is going to recover very quickly because all the people that have not been going to hospitals are going to have to go, and there'll be a backlog of treatment that will be necessary, and the businesses will recover. I hope.
Yeah, I hope. During the COVID, I did the two aortic surgeries. One was a lady with 95 years old with expanding infrarenal. So we did that percutaneously. She stayed in the hospital for 48 hours, and it was very, very nice. She has nothing with COVID. And then we get also a thoracic one, and then we did the same. And I also did outside the Rio 3 thoracoabdominals with branches. And all those patients did very well, except one that had arch, thoracic, thoracoabdominal, and infrarenal. So
wow.
This guy, unfortunately, the surgery went very well, but his inflammatory response was just like a COVID infection, you know, although he was not a COVID patient. But, sometimes the response is very aggressive after a lot of devices. The patient.
Right. And sometimes the COVID tests are wrong. You know, they're false positives and false negatives. And so, it's a crazy time. But the stuff you're doing is exemplary. It's wonderful. And I think that will all go back to normal, hopefully by August, maybe September. But getting together, meetings and all, that will be delayed more because we have to make up all the financial shortfall that the hospitals have.
That's true. Yeah, we got a question here. People are afraid they don't want to go to a hospital. What is the program to encourage the patients to go to the hospital? Well, I think the media could help us because in Brazil, at least, the media is putting the patients in the psychiatric hospitals. Because
I couldn't agree more. It's the same in the United States. The media, I believe, are, at least in the United States, are evil. They like to make people afraid because they think more people will watch them. The hospitals have all developed really remarkably effective techniques for minimizing the possibility of getting the virus. And I think the hospitals are now probably the safest place to go. And I think the media should stress that. They don't do it because they're interested in promoting trouble. And that's very evil on their part.
It's true. It happens in Brazil a lot. You know, one of the people that work with me said, you know, doctor, after seeing the TV show in the Sunday night, after the end of the show, I was out of breath.
Right.
She has nothing, but
right.
just seeing that, she said, I was just out of breath. I said, don't see TV. Stop seeing.
I think that we should try to influence our media to be honest about this business of hospitals being safe, and going to them is not a high risk event.
You know what? You know that better than me. The problem is the media made a lot of money with the ugliest thing.
They do. They always do.
They don't want to show the success.
Absolutely right. They want to show bad news. Bad news makes them money. And I think in the United States, the media has no conscience. They don't believe in telling the facts. They just believe in promoting their own financial success. And it's evil. And I stopped watching them because what they show is often very dishonest.
I totally agree.
Really very wrong.
Totally agree. You know, it's difficult because you cannot control them because it is anti-democratic, but I'm sure they don't have conscience. They are not doing the best for the people.
I think it is fine to have democracy promote the media, but somehow we should make it obligatory. We should make them tell the truth. They have no conscience, and they're not held accountable when they don't tell the truth. And that's a very serious problem.
The thing is, if I go to your meeting and I say, it's good to put a stent in any artery, people would ask me, so now you prove it. So I have to prove.
Right.
With series, with cases, etc. And then the guy in the media, they say something. Well, Marcelo is going to die. And then everyone believes. Nobody wants to, please prove that.
Yeah,
before you tell people.
Well, I mean, you know, the horror of the Germans in World War II was that they controlled the propaganda and people believed them. And that's happening today in the United States. Trump calls it fake news. I call it dishonest news because they never correct the facts when they're proven wrong.
Yeah.
They just go on about their business. And that, to me, I think there should be a legal obligation that they have to tell the truth.
Yeah.
At least acknowledge when they're wrong. But doesn't happen.
It doesn't happen. Doesn't happen. That's the problem. I think I remember, you know, I like the history. And so I read that Caligula, the emperor in Rome, someday he asked to one of his, lieutenants or secretary to, well, tell that one of the guys in the Senate is corrupt. The guy said, well, Caligula, I can't say that because the guy is honest, he's clean. Caligula said, keep saying he's bad, he's corrupt, because if you repeat that many times, people will believe. So that's the theory.
It's happened in the United States in the last 3 years. It's outrageous. I mean, the whole accusation of our government being in cahoots with Russia, which has dominated the media and the newspapers, is just, there's no basis in fact. And it's exactly what you're saying. Our media are like Caligula. We should call them that.
Okay, we have one of our friends that works in a front line against COVID, Dr. João Pantoja. And he did his training at the Mayo Clinic a long time ago. So he asked you, what happened to the large Manhattan hospital during the worst COVID period? Were they overwhelmed by COVID patients or become idle?
No, I think all the hospitals in New York were somewhat overwhelmed. They all had to open multiple extra ICUs. They all had many patients on ventilators, some on ECMO. They were overwhelmed for a short time, but they were not overwhelmed as much as the media were saying they were going to be. And in New York, there was a bad week when there were a lot of deaths.
Hey, hello.
Yeah. Beautiful. Beautiful. A tiger.
It looked like.
Like a tiger, yes. But in the end, the hospitals all took care of all the patients that they had to. They provided ventilators for all the patients they had to. They didn't use any of the emergency hospitals.
As you said, now the hospitals are calling the patients to come because it's safe to go there.
Yeah,
but
they're
before
calling
any surgery, the patient has to do any test, or if the patient is okay, fine, no test, just go ahead.
Well, my wife and I went to a hospital yesterday for a reason, to check up on something she had, and they did take her temperature. We had to wear masks. There were other precautions, but I felt completely safe. And I guess before they do surgery, they do a COVID-19 test. And of course, there should be more tests of antibodies, accurate tests of antibodies. But I think this will pass. It's just how long it's going to take.
Yeah. Maybe, I think until the end of this year, people will still be afraid of getting infected. If the vaccine comes, I think all the things are going to change. You're going to see another scenario.
No question. That would be a wonderful thing, but vaccines are very tricky. You know, sometimes they can make people sick as well as providing immunity. So it's a challenge, but obviously our government, and I think yours, are expending a great deal of resources to make a vaccine that works.
Yeah.
And to pay for it.
I have another question here from a very good friend, a cardiac surgeon, Leonard Ferber. He's always been in your meeting. He's enjoyed a lot. And he asked you that the CDC has reported 42% decline in the emergency room visitings last month in the U.S. And how big is the impact in major vascular emergency in New York City?
I think that's a correct number, because people in the U.S. go to the emergency room often for things that are not emergencies. And those are the things that are decreasing. If somebody is in a car accident or has a real emergency, I think most of the time they're going. But it's also been true, our interventional cardiology friends yesterday, Sahil Parikh, who was our cardiologist on our webinar, was saying that people are not presenting when they have a stroke, particularly a small stroke or a small MI. And as a result, they're not getting good treatment. So that's real. And I think, again, the media have been very guilty in promoting the fear factor, which has kept people from hospitals.
Yeah. You know, another friend, Dr. Luis Godinho, He's asked us to talk about elective procedures. I just mentioned you that I talked with, like we did today, I did it with Gustavo Derich. And in Rochester, they had about 80 cases, something like that. It's very...
Nothing. They had nothing.
Nothing. So Mayo Clinic, they restarted 15 days ago, and now I think they are almost 100% doing elective procedures. They restart doing at least 90% elective procedures. That's the case
That's
in New York.
correct. I've talked to the Mayo Clinic guys too. The problem is that to get to the Mayo Clinic, you have to fly in airplanes. And another thing that people are desperately afraid of is flying in an airplane because they've heard all these terrible stories. I think we have to open up our airlines. It's part of our life. If we keep our economies shut down, as we in the United States have been doing, often for political reasons, not for real reasons, I think we'll be living in the Stone Age. It'll be terrible. So I think, number one, we have to take care, but number two, we ultimately have to take some risk and open our economy, or the downside, the penalty, will be even greater than the risk of the virus.
Yeah, talking about that, we had a conversation, a live conversation with Germano Melisano from Italy. You know him very well.
I know him very well. He's a wonderful guy.
He told us that nowadays in Italy, especially in that region, Lombardy, the unemployment in young guys below 25 years old are 50%.
Yes, true.
Half
in the United States.
Of that young people do not have an employment.
I mean, our government, I think, has done a pretty good job of compensating for that. But we have, I think, 40% unemployment. And again, if people can't buy food because they don't have the money to buy it, that will lead to chaos in the streets.
The chaos.
And we're already seeing some of that.
Yeah, that would be the chaos.
So I think it's absolutely mandatory that we take the precautions, but that we open up our economy as quickly as possible. And unfortunately, because of the press and some of our crazy politicians who want to cause trouble to gain power, they've prevented that from happening.
Well, I can't understand that during that, storm, the politicians are still fighting for power instead of fighting against the virus, fighting for the people. That is totally unacceptable.
That is the story of human nature for the last 100,000 years. And whether it's in medicine, politics, government, whatever, it's catastrophic. The politicians should be doing what's best for the country. But in the United States, some of the politicians are doing what's best for them as a means to gain power. And that, to me, they should all be put in prison or worse.
You know what? That happens in Brazil. Exactly that. They are fighting for the power, not for the people.
It's human nature. And it goes back to Roman times, to Greek times. It's unfortunately, we need to have a pill that creates morality in people. That pill is very necessary.
Yeah, we have a question from Micaela. She is responsible for all the marketing in the Tatiana family company. And she asked you, are there any consultations being done by internet? So video consultations?
Oh, yes. We have what we call telemedicine. And it works very well for, say, lower extremity ischemia because you can look at the foot, but you can't touch the foot. You can't do all the things that are necessary. And I think telemedicine will be a great adjunct but it's not going to be, it's like virtual meetings.
Yeah.
It's better than nothing.
I think especially for our specialty, because sometimes you should see the fingers, you should see the leg, you should feel the aneurysms.
You should touch it. Right, exactly. You can get non-invasive tests and all the rest, but it's not the same. And I think that the interaction of the patient with the doctor, telemedicine is better than nothing, but it's imperfect.
Well, we still have another 25 minutes. I want to change the subject for a minute.
Please.
So, maybe we have 100 people seeing us, follow the meeting, our meeting. You did the first minimally invasive aneurysms in America.
We did. With the Argentinian.
How was it?
It was totally different than now. There's a very funny story that we went through I wrote an article about it once. We went through all the tortures to get the equipment and to get Perotti to come to our poor hospital in the Bronx. I call it a third world hospital. And we finally convinced Perotti to come. We had to put him and his colleague, Claudio Schoenholz, and another guy in one of the fanciest hotels in Manhattan, which we did. And Perotti came, and he came to our inner city hospital in the Bronx, and he looked at the equipment, and the X-ray technician who was supposed to be in attendance said, "I can't work anymore. I'm done for the day." And he left. And Perotti says, "I can't do this case. There's no technician. Your X-ray equipment is terrible. It's prehistoric. I'm not doing the case." So we finally persuaded Juan Perotti and Claudio Schoenholz to do the case with us, and the patient did great. The next day he was up in his bed reading Playboy, and he was a very sick old guy with a big, tender, painful aneurysm. So we were lucky. It worked. And that led to a whole series of events and our embracing endovascular technology, which of course at the time, this was before you were born probably, at the time was very unpopular. Nobody in vascular surgery paid any attention to us. They all thought we were crazy. But I happened to be president of the SBS and another organization at the time. And so I promoted endovascular as the fact that I'd seen the light. And everybody thought we were crazy, but you know what's happened. Guys like you have gone 1,000-fold better than any of the things we did. I mean, we lost so much blood from the sheaths and all the rest that we used to make jokes about hooking our table up to a cell saver. But nowadays, none of that happens. It's easy.
It's amazing how technology will.
It's technology and skill.
And skills.
You particularly Marcelo and Oderreich, another Brazilian, and many, many others have taken it so far beyond what we did in the beginning. I have the analogy that it's like in the beginning when airplanes were first invented, they all crashed. And now, look, jet airliners, they never crash, and almost never. And it was the same with us. In the beginning, it was not easy, and we were very primitive.
Yeah.
But it worked, and it was dramatic. We could do patients, take care of patients that were totally inoperable by any other means, and they got better. Right. And when I presented it to all the other young vascular surgery leaders, and Perotti and Marin were with me at this meeting, and nobody believed us. They said, "You're lying. You don't know what you're talking about, and what you're doing should be done by radiologists." So, and not one of them supported us. And these are all the famous vascular surgeons of the day. Anyhow, that's progress.
That's a very interesting story. Very, very interesting story. You know, And it happens here. I start doing those C-arms, even thoracoabdominals. I start doing the thoracoabdominals here in Brazil in 86. Excuse me, in 2006.
Right.
So 2006 is back 15 years also. So it was the CR.
No, and nobody believed you, right? Nobody said that, oh, that's wonderful.
Nobody believed it. We have to stop because the C-arms hit. So we have to stop for a while. Right. And the surgery took about 6-8 hours, 300 cc of dye. And now we do the thoracoabdominal cases in 2.5 hours with 50 millimeters of contrast. So I think changed a lot.
But in the future, within 10 years, we will be doing it without radiation.
I'm sure.
With virtual stuff. Sure. But let me tell you one other interesting story. When we started, we had to have a C-arm in the operating room. Our hospital wouldn't buy it. And we couldn't use the orthopedic ones because they didn't have cine for the, the fluoro movement. So we found a C-arm that was in the garbage being thrown out by the interventional cardiologist from their dog lab. And we said, let's take it. Maybe we can make it work. And that was the C-arm that we did the first case with Perotti. And when he saw it, and he saw the quality of our table and the x-ray tech that left the room before we started, he said, I can't do this case. I'm going back to Argentina. And fortunately, we talked him out of it, and the case worked. But that was how primitive we were. And I learned how to use the fluoroscope because none of the x-ray technicians would use it.
Yeah. You know what? I saw my first infrarenal cases with Juan Parodi. I thank him for the opportunity. It was wonderful. But years later, and I think in 2012 or 13, he invited me to do his first 2 thoracoabdominal cases. So I did. He teach me to do the infrarenal, and
you taught him later.
I did his first thoracoabdominal case. It was an honor.
That's great. That's great. No, he's an amazing guy. I mean, now he's talking about drinking lots of water and albumin to cure arteriosclerosis. And, maybe he's right. We'll see. But he's a very clever guy. And
he's a genius. He has great ideas.
He's got incredible ideas. He was really the one who developed this reversal of flow for doing carotid stenting. And, he also was the one who developed the Aptus anchors, endo anchors.
Now, yeah.
And he tells the story how he made no money from it, not a cent. Someone stole the idea. And now it also works.
It also works. You know what? I have an interesting question from California. Zeca Style, he asked you, sir, do you think this is a plot? Are you saying that was superplayed by the local authorities? I speak as a Californian citizen.
I don't know. What is the plot?
He think he's like the government hiding the true story from the people?
No. I don't think the government is hiding anything. I think the press is dishonest. I think if you look at CNN, which is in every airport in the world, or MSNBC, which is another big television, or the New York Times, which was my favorite newspaper as a boy, or the Washington Post, these are all the media, and they don't tell the truth. It's unbelievable. Now, am I biased? Maybe a little bit, but I think when you look at the facts, they make many mistakes and they never correct them.
They never correct.
That is what's wrong. And they're entitled to their opinion, but they're not entitled to falsify facts. And they do.
You know, they said in Brazil that the worst part is coming. It will be in July. But what happened is our cases are decreasing abruptly.
But see,
and nobody comes to TV and explain that.
That's a prediction, and that they shouldn't do that. They should acknowledge that they don't know. But what's even worse than that is when they falsify the facts. And our media in the United States, as a general rule, maybe it's because they don't like Trump, but they don't tell the truth. And that ain't good. That's very bad, because 99% of people make their judgment in their head on the basis of what they read and see on television. And when it's wrong,
they could not use that. The press could not use that as a weapon against the government.
They can. They do.
They use it like a weapon, even in Brazil.
It's a weapon. Absolutely. It's a very effective weapon, because I call it drinking the Kool-Aid. You know, that guy in Jamestown, he got all his participants to drink poison. And that's what we're doing, because the media is providing the poison. Yeah. And as a result, it's very possible that the United States, I don't think this is true in Brazil, but it's very possible in the United States that as a country we are going to fail. And that would be terrible. But it could happen.
I don't think you're going to fail. I think the Americans, they have the power, you know, to reborn. I don't think. You know, as soon as the virus go away, that's going to happen in Brazil and also in America. You're going to grow again the economy.
I agree. I agree partly about that, but people are not, it's not their mentality to question authority. And when you see something on TV, you read it in the New York Times, the greatest newspaper ever. It used to be. It's not anymore. You tend to believe it. And I believed it at first too. And then it became obvious to me, just like endovascular became obvious to me, that when people said it can't work, I don't know if you remember the name John Porter. He was a very famous American vascular surgeon.
From Oregon.
He said, this is never going to work. And if it works, you shouldn't be doing it. And at first I believed him, because he was a very persuasive guy. He was very articulate. And then I realized he was wrong, because I was doing it and it was working. So that's a little bit, it's human nature. And what I worry about is that human nature doesn't always end up directing countries in the right way. I mean, look at Nazi Germany. Germany's a great country. The people are very good. They're like us. Yeah. And yet, look, they embraced Hitler. Why? Because he controlled the media. Yeah. And he who controls the media controls the country. They control people's minds. And that's true in vascular surgery. It took years before vascular surgeons embraced endovascular.
It's true.
And they thought I was a bad guy. I thought I was causing trouble.
You know, we have a question here from Dr. Carlos Peixoto from our society. Have you returned to do elective surgeries like varicose veins, like more simple things? Do you believe?
Yeah, you're asking in general. I'd say the answer is yes, but not fully yet, because the patients aren't coming. Varicose veins are really very elective.
People are afraid.
People are afraid. They're young. They can get along without the veins being treated. But I think when it comes to an aneurysm, a stroke, a symptomatic carotid,
they go.
A dead leg, I think they have to be treated, and they are being treated. And at NYU, where I currently work, I think we're back to 60 or 70%. And you said Mayo Clinic is 100%.
Yeah. You know, we have a comment here from Dr. Júlio Pecla, who will be probably our next president of the society, the Brazilian Society. He has a very good experience with COVID limb disease. He wrote a book, and he said, congratulations to both of us. Be sure that Veith Symposium in February will be the best ever. We are in need of major international events.
Thank you so much.
Thank you.
But
Dr. Leonardo Feber asked you if you think that the budget for health will increase after COVID era in the U.S.
That's a tough question. I mean, the government can't keep paying people's salaries forever. People have to go back to work. We have to start producing cars, everything else. Our companies have to be open again, and we have to start paying taxes again because we're making money. I mean, just when you ask about our meeting in this year and next, I'm very worried about it, because if we don't get a lot of people, we'll end up losing money, which is okay, but that can't go on forever. At some point, we have to be able to pay our people and so forth.
We have a question from Vania Palmeira Tamussino here. He asked, I think, about our comments on the media, like the media is doing harm for the people. She said, but there is also scientific articles in the media. I would say to her that the media pick up the worst scenario, even in scientific articles. What do you think?
You're 100%, very good question. You're so right, because some of the articles in the scientific literature are wrong. And we've just had 2 experiences where an article has been retracted from Lancet and the New England Journal. And I had that guy on our program, and it became apparent, I think, I hope I'm right, that some of the data wasn't accurate. And so our scientific, quote, peer review process is not always right.
It's not always right. Yeah. It's why the World Health Organization changed that position about quarantine. They changed their position about virus transmission. They changed their opinion about chloroquine, you know, because nobody knows the truth still.
Because nobody knows.
We are learning.
The problem with the WHO was they were politically motivated to not tell the truth. It seems. I believe that's right. That's unforgivable. People make mistakes. You can't know the future, but you should be as honest about it as possible. And I was telling somebody earlier today on the phone that a man named Emmerich Zalagi, who was a famous American vascular surgeon, gave his presidential address on errors in the Nobel Prize. That the Nobel Prize was given for things that proved to be false, and in some cases, the person who got the prize was fraudulent. They falsified the data to get the prize. So nothing is perfect.
Nothing is perfect.
Of course, I wonder why our President Obama got the Nobel Prize for doing nothing. He may be a good guy, but he got the prize for no reason.
Yeah. You know, I remember an article that was published in the Journal of Vascular Surgery. And then one of the industry, I'm not mentioned, asked the judge to oblige the journal, take that out. And that was absolutely true.
Yeah, absolutely. We have an article, myself and another guy, James Stanley, that was accepted in the Journal of Vascular Surgery, and then they tried to remove it for political reasons. We'll see what happens.
You see, we have also one of our last questions from Samuel from São Paulo. He asked how difficult it is to get sponsorship from the companies in this difficult period.
It's always difficult. It's more difficult now because the companies aren't making money. But I tell them that if you don't market your goods, if you don't make what you're making known to your customers, you'll never sell them. So hopefully they will support our meeting. We'll see. Maybe they will, maybe they won't. There's a lot of unknowns, and we're scared.
It is, of course. We still have some few minutes. First, I'd like to thank you so much for being with us this night. Here is around 7 p.m. And as you can see, it's night up there.
Yep.
We see the Christ here, this white dot.
Yes, yes.
And has been a great pleasure to see you in good health, to talk to you, and all the company, Tatiana, Micaela, Stefan, and her father, Ekenhard, they also thank you to be with us this night. And I let you say we have still 2 or 3 minutes. This live will be recorded and stay in the Instagram as a EGT move, so everyone can access. And then after 48 hours, it goes to YouTube in the Tamussino channel. So it will be there forever. We can see that again and again. So
Marcelo,
thank you very much.
Marcelo, I would like to thank you, because everything that we've spoken about have been favorite topics for me. So I'm the one who's benefited from this. I feel very good about it. It's been a very pleasurable experience, and I look forward to more Brazilians coming to New York and me coming to Brazil.
I'm sure they will. I'm sure they will.
So.
We're going to incentive them. We're going to, you know. And thank you also to Jackie and Pauline who helped us to put that together. And I let that message it.
Thank you very much. God bless Brazil.
So I hope to see you very soon and in February in Miami.
Okay. Stay well.
Stay safe. Stay well. Bye-bye.
Okay. Thank you very much. Bye. Bye.